my name's Amanda, and I'm here to demonstrate how to maintain a sterile field. Sterility is extremely important if you want to reduce the risk of surgical site infection. Surgical site infection can result in sepsis, death, lawsuits, bankruptcy, homelessness, starvation, and death. So we don't want to do that. So as you can see, we have a sterile field with a patient who is under general anesthesia. It is ready for a tummy tuck. That will be the procedure we're performing today. So the first thing you want to do is ensure that all the furniture that you're using is sterile and has been sterilely draped. You want to make sure that any furniture that you are not using has been cleared from the room. Darn, never mind. You want to make sure that all your sterile fields are at least 12 to 18 inches from walls or any equipment or walls that are not sterile. You want to make sure that you limit and control the traffic in and out of the OR, because increases in traffic can increase air particles that can increase the chance of an airborne infection. And we don't want infection. You remember what happens there. So, the last step you want to do is maintain sterile supplies, and you want to make sure that you only open them right before the procedure. Luckily, I have already opened all my equipment because I'm about to perform my procedure. So, again, my patient is under general anesthesia, so I'm going to take my sterile drape, and I'm going to drape the area that will be undergoing surgery. As you can see, we have a lot to work with here. You know, it's gonna be a doozy. So now that our field is draped, we are going to clean it with an antiseptic of your choice, and then we'll be ready to go in. But oh no, you started the procedure and you forgot something. You need a new tool, you need a new instrument. What can you do? Well, luckily, you have a circulator. A circulator is someone who can put instruments on a table, even though they are not themselves sterile. So in order to do this, they will go collect the equipment that you need, and they will open it onto the table. First, they will ensure that the package integrity is intact, it is fully clothed, and it is not expired. So, even though they are not sterile, they can open the package and flip it onto the sterile field. They want to ensure that they are not hovering or standing over the sterile field as they flip the item onto the table. The instrument is now able to be used in a sterile field because they use aseptic technique to open it. So now we are ready to perform surgery. Using all of my sterile equipment, which has been either autoclaved or is disposable, I'm removing all the excess skin. In order to be donated later to burn victims. Once I'm through, I will bandage the patient using my sterile bandages from my sterile field in order to reduce the chance of infection. And that is how you maintain a sterile field. Good luck.